Dr. Cahana, how are you?
Very well, and Happy New Year.
Happy New Year, happy healthy New Year, and as I've been saying, let's make 2020 the year really to remember, versus 2021 the year really to remember, not 2020. So welcome back. I'm super excited. We started talking about it a little bit, and I had to stop us because I want to talk about this here. You're going to Africa, and you're doing some amazing stuff, and I do want to get that book called Weird that you were talking about and read about it. But you talk about, and I got to read it. You talk about holocratizing healthcare, if I pronounce it correctly. Can you,
Yeah.
first of all, give us an update on all you're doing, and you're going to Africa for what reason, and what your thoughts are about what's happening and what should happen.
Well, I would start by, first of all, also wishing you a healthy, happy, and a safe and creative year. Working in Africa is part of an extension of what I've been doing last year, and that is trying to help leapfrog the healthcare systems in Africa from analog to these decentralized, if you wish, Web 3.0 or blockchain systems. I think that, it's very curious that when you look at how countries are dealing with COVID, Africa, and it's difficult to talk about a whole continent because there are different countries and different systems, but Africa as a whole has been the continent that has dealt best with the pandemic. Asia is close second, and then we all know where Europe and the US stand. And it's curious for me. I was thinking about it. Why is it? And I came across a book called "The Weirdest People in the World" by Joseph Henrich, where weird stands for Western, educated, industrialized, rich, and democratic. And I kind of smiled when I was reading it, but to that point, I kind of tried to understand, what does that, what does that really mean? And I think that, we live in a culture where we're highly individualistic and we're obsessed and control oriented and analytical, and we focus on ourselves, on our attributes, accomplishments, aspirations, and we don't really think about the community, and we don't think about relationships and social roles. And I think that this is what the reason of this approach is causing our difficulties with dealing with COVID, is this underestimation of the interconnectivity between us, the impact that we have one on each other, and it's called in medicine, we call it ingressive behavior. When you're like, you want to win all the time and be right at all costs, and you overestimate your ability and underestimate the ability of others, and you act only in self-interest without caring about the other, which is very different than congressive behavior. It's like the community. And I think that combined with the fact that Africa has been, it's very experienced in acute outbreaks and understands public health. They don't execute their constitutional right not to wear masks. They just simply wear masks. And the fact that 50% of them are under the age of 30, I think really poises them to be better. So it's fascinating to do that. It's fascinating to work with them. And we'll be heading out to help them, not only with COVID related things like supply chain and vaccinations and access to care, but more importantly, really putting in what we talked last time. And these are the self-sovereign electronic health records, and this idea that you can port your medical record and you can actually get money from healthy behavior, kind of a universal health income. And so that answers your question, what is holocratizing? What is holacracy? And holacracy is basically what you and I are doing, is that we see a problem, we want to solve it, so we self-assemble, we start to work, and we execute. So we don't ask for permission, we don't congregate and vote and have elections and create all this, a pageantry and rituals around it, and you'll be the chief of everything and I'll be the chief of everything too. And it's like, no, we just get stuff done. And that's the essence of holacracy: get stuff done.
It's interesting. You said public health, and I guess there's two key words there: public and health. If you think about it, and one thing I've always found in the work I've done is that next to food and air, belonging has been proven to be the thing that fulfills our heart and soul more than anything, and in a way creates the action that you're talking about. What's good for our community, right? And it sounds to me like it's back to basics, what you're talking about.
And absolutely, absolutely. And you talk about the commons, and we talk about the tragedy of the commons. What's private is private. What's in my house, I keep clean. But then what happens to the hallway? What happens to the sidewalk? Who belongs to that? And who's going to take care of that? And if everybody throws their handkerchief or their Kleenex on the sidewalk, who's going to keep it clean? Right. And so it's a lot about personal hygiene. It's a lot about the social contract and the obligations that we have to each other. And so if we have an extractive, exploitative, instrumentalizing culture where you are only a means for me, and we don't have a concept of camaraderie and friendship and solidarity, if only when I'm talking to you is because you're my key to fame and fortune, and you're talking to me only because you want to expand your business, all this is fine, but it cannot be the business model. And this is why in Africa we built in what we call Ada Labs, named after the first woman coder, Ada Lovelace. But the idea of Ada Labs is that we believe in what we call the theory of the camel. And this is it's like the opposite of unicorns. We don't want to be a unicorn like this magical $1 billion, and now they're decacorns and hecacorns and I don't know what, and $1 trillion. No, we're not talking magical or imaginary animals that don't have any real natural ecosystem. It's about a camel. We're very frugal. We don't need a lot, and we can go a long way and do the work and schlep people and move. And we do better in a crowd. I learned that, a horde of camels is called a crowd. So when you walk in a family, in a crowd, you're able to move forward and have a lot of power in the network effect. So obviously the being close to camels, not only because of Africa and being there, but the concept of frugality, long-termism, the interconnection in the community, and being focused on pragmatic solutions. I think that's really the way to go.
We talked a little bit about mental health last time, and it's obviously become to say the least, a huge thing in so many ways, even, because of what's happened. And it seems to me, I came from Montreal and where we had communities there, it seems to me that there's a connection between being connected to the community you're talking about and mental health.
Absolutely. These type of behaviors that weird people do, that we mentioned earlier, really the end point of it is isolation, and we talked about that, malaise and mental anguish. Mm-hmm. And I want to point out to people that it's not only because the COVID virus does stuff to our brain, or it's not only because we're isolated and we miss our friends and we miss our family and miss to do stuff. It's also because the system has been designed to cleave between us, that to extricate this idea of a network effect. And I don't know, I wrote another post about this. If you heard this new app, it's a very buzzy app called Clubhouse. It came out now. Yeah. So I'm on Clubhouse, and I've been looking at my phone, and I took a screenshot, and I said, wow, like I am spending a lot of time. And now it's not as if I'm not a busy person, but there's something about it that is so attractive. And just for people who don't know what Clubhouse is, it's a voice only app. And so as opposed to, text, which is like, Twitter and Facebook, or videos, which is YouTube and TikTok. This is voice, which, by the way, I'm surprised how appealing it is, because I'm not really a podcast person or a audiophile, on audiobooks, but it's very engaging to hear people's voices and hear how they come through. And what I realized in this experiment, which for me is it's a decentralized social experiment, because people meet, they create these rooms. Some rooms are more kind of like, let's tell jokes and party. Others are like super serious with subject matter experts. Not only do you meet your community, but you also meet people that you've never heard before, and you can exercise radical empathy. And by listening, and hearing other people speak, you suddenly say, I am not the only one there. And so I think that we're replacing um, social distancing, which we're now exercising, which is causing that mental health or mental anguish, with physical distancing and social solidarity. That's really what we're doing here: physical distancing and social solidarity.
Yeah, I think that it was a bad move calling it social distancing right from the start. It should have been physical distancing, because it made people just even feel that they're more socially disconnected and stuff. And I have heard about Clubhouse. Respecting your time, how would you then change? Because I know we're talking about changing, and you say, well, maybe we don't have to change our system, but what would you do? It reminds me of Latin America when cell phones and what came in. They had an easier time doing it because they didn't have whole infrastructure already before, so the cell stuff came in. Here we have a healthcare system already. How do we get to where you're going in Africa, per se, to come back to being more effective here?
It has multiple layers to the question of what to change, and some things can be changed immediately, and some changes can be more long term. I don't think that we need to play the optimization game, although this is what people like. How can I make my scheduling easier? How can I make things, frictionless? Oh, so cool. I can just click on an app and it all pays. I think that's okay. But if we really want to make our system resilient, and we really want to respond better to the next outbreaks, to COVID 20, 21, 22, whatever awaits us, um, it's really all about data. It's all about the movement of data, the availability of data, the transparency, integrity, and the governance of data. And I know that for the audience and for everyday people, this is what is Alex talking about? What does that mean, data and all this? I would say that the most important thing that we're not doing in the US, and if there's one thing that I would like, if I would be in Congress or to have to change, people's minds in a switch, is to say, let's look at data as dignified work. Let's look at it as dignified labor. Let's consider that data that you create by your actions, by your behavior, by your movement, right now is captured all the time. We're talking, Zoom knows we're talking. They are recording everything. They are analyzing it with AI. They're running it through their algorithms. They are making money on this. And we are seeing absolutely nothing. And the same thing goes for the 5 companies that rule all the data in the world. Mm-hmm. We have become the products where we share our data for free. And if we start, not only because of privacy and security, but start to say, wait a second, I am my actions. My actions are captured by data. And that data is who I am. When someone takes that and uses it, abuses it, loses it, and sells it without my explicit understanding and permission, not, page 72, I agree, but actually asked me, do you mind? They're actually taking a piece of me. And so if we look at data as dignified labor, and this is what we're doing in Africa, we're going to the doctor, getting a vaccination, wearing a mask, taking your kid to take vitamins, all these things are regarded as dignified work. That's the extra buck that you need. And so there's no need for stimulus checks. There's no need for hands out. There's no need, because I am doing so many things today that are valuable. If I would just be reimbursed on it, if I would just be compensated, if I just be recognized, a monetary recognition of the goodness and contribution that I am giving to society, not just based on some volunteering because I'm a good guy thing,
So,
that would change everything.
so it sounds to me, if I'm wrong, you'd say it's what we call an omni-win, actually a major omni-win. It's probably going to be less costly than what we have now and more beneficial than what we have now combined.
Of course, of course. And people will be more engaging because that's what people want.
Mhm.
So I'll give you an example. It doesn't have to do anything with healthcare. And this goes back to the camel and unicorn. So everybody wants to be an influencer. Everybody wants to be you when they grow up and have that outreach for the whole world and all. But it's hard. It's hard to be you. It's hard to be Kim Kardashian. It's hard to be, Beyonce. How do I do that? So for example, we had a simple app that we created for micro influencing. And so, for example, let's take a beverage vendor. Okay, they want to reach to people, so they reach out to you, and your ringtone changes to their product, and you become a micro influencer for the day. Every time your phone rings, everybody hears whatever, and you get that extra dollar. If you answer a couple of questions, you get another dollar. If you recruit 5 people, you get another dollar. If at the end of the day you take those $4 and you put it in your savings account, which is also on your phone using blockchain, then the company matches 3 times to it. And suddenly, for making $1 a day, you're making $15 a day. So it's about a network effect of participating and making everybody part of the economy. And that's really what it's all about. It's the micro payments, micro transactions, micro influencing, micro health. It's not unicorns. It's just about inclusion. It's about dev before rev, developing people and boosting them before revenue, and not the other way around. And that's really what's exciting, because we don't need handouts. We don't want handouts. Those that are vulnerable in society, perhaps. I'm not saying there are people that, but the vast majority of us, instead of feeling victims of an exclusionary economy, it's not because on the 11th commandment it said, thou shalt not get money for your data. It's a decision. So I don't recall my insurance company paying me anything last year for not using a drug. Why am I not getting that, revenue share? I don't recall when a certain company sent my genetic information to another pharma company without my permission or with my unwitting permission. I don't recall getting a check. So the fact that you think this K-shaped recovery, where there's so few that get so much and so many that get so little or nothing,
Right.
is not sustainable. It's not, and I'm a big fan of biomimicry. Nature is a good thing. So I'm not saying we all have to be, vegetarians. There are carnivores and there are omnivores. There has to be a balance, but it cannot be just omnivores or carnivores. And that's really what's exciting about working in Africa, because they are attuned to Earth. They are attuned to understanding biomimicry and how nature works. They understand the power of technology, but also understand that technology doesn't do anything. It's what people do with technology,
Right.
that makes the difference. So you can tell that A, I'm excited, but B, there's a way out of this. There really is a way out of this. We just have to stop being weird. That's all.
I like being weird, but not that type of weird.
Not that type of weird. You like being a camel, not a unicorn.
Yeah, with a hump. Um, it's fascinating stuff. It's brilliant, and I guess like they say in LA, we have to keep them wanting more so we can do a sequel. So when you come back from Africa, I want to have more time and hear what happened, and and hear how we can potentially support as well.
I really appreciate you. I appreciate, the work that you're doing, the stage that you're giving to us to really share all this good news, because we need that good news. We need to be inspired. And, as an anesthesiologist who really works with resuscitation and vital signs and making sure that people stay alive, and, COVID has taken so many lives. I was thinking about this for a second and saying that the soul in Hebrew is called nefesh or neshama,
Mm-hmm.
which comes from the root to breathe. And so we should just not let COVID take away our breath, shouldn't take away our soul.
Right.
And that's really what it's all about. It's time for getting antibodies, not just to COVID, but antibodies to indifference, and really understand that we grow not by preserving ourselves, but by losing ourselves in service for others. That's really what it's all about.
And when you do, the feeling you get is incredible.
Yeah.
Yeah, I like to see that as the Chaim.
So again, many thanks, and we will definitely get in touch when I'm back from Africa.
Thank you. Take care.